Hi everyone, I am a student at Plaza College. I'm a dental hygienist, and today I will be doing a presentation on the periodontal probe. So I'm using a PowerPoint to explain everything so that I can go off these notes so I can explain the periodontal probe. So as dental hygienists, we learn early on that the probe is essentially one of the greatest instruments during the assessment phase. So we probe to record the health or disease of the patient. We can evaluate healing or determine if there's a need for a more aggressive treatment, along with, of course, dental radiographs. So the complete periodontal evaluation allows us to gain important measurements and observe a patient's oral health. So today I will be discussing the UNC probe. So this probe is a long, thin, and it has a blunted end. This is the handle. This is what's considered the handle, and this is considered the working end right here. So what is this periodontal probe for? So the process of the probe and the most effective way to evaluate areas of inflammation is by using this instrument. It measures in millimeter increments and measures the distance from our deepest extent of the pocket that surrounds the entire tooth surface of the tissue. Healthy gingiva will have 1 to 3 millimeter increments. So I'll explain that. This is the handle and this is the working end. If you look closely, my probe has little increments, as I mentioned earlier. If you see the first little increment, that's a 1 millimeter. Then the second is a 2 millimeter. Third, 3 millimeter. And then once it gets to the first black line, it means it's a 4 millimeter. After that, after you can no longer see the black line, it is considered 5 millimeter and above. And we'll continue discussing what it is. So, as I said, the healthy gingiva is 1 to 3 millimeter pockets around the entire tooth. It is considered healthy because when a toothbrush and a floss are used correctly, you are able to remove the plaque that surrounds that tooth in order to keep the gingiva healthy. If you effectively are able to remove the debris from our teeth and that area, your gums can essentially continue to stay healthy. So now, what happens when the probe goes to the number 4, past the number 4? So inflamed gingiva will often present with 4 millimeter deep pockets surrounding the tooth. Inflamed tissue develops when there's too much plaque, too much food debris, calculus is underneath the gum and hasn't been removed. As the debris sits underneath the gum line, the inflammation process starts and the immune system tries to fight off the plaque. Therefore, you end up bleeding. So as part of the inflammation process, the gingiva may develop puffiness, may be prone to bleeding, and eventually develop into a deeper pocket if it's left alone. So as I mentioned, that this is the narrow working end, and this is the narrow working end, and this is where you want to insert into the gingival sulcus without causing any damage. So I will demonstrate with my my finger because I do not have a typodont. So because this end is blunted, I don't know if you can see that. Because this end is blunted, there's no, we will not cause trauma if it's used correctly. So what is it used for? You measure probing depth to determine degree of inflammation. You can evaluate furcation lesions. You can evaluate the extent of tooth mobility. Another good thing about the probe is that you can measure pathology, which is amazing to me. You can measure pathology extraorally or intraorally. If a patient has a lesion, let's say something as simple as a canker sore, you can always measure in increments and write it down on your notes if it's a 3 millimeter, if it's a 5 millimeter, or if it's past the 9 millimeter. And you'll record that in your notes. So, to proper use this probe, you have to insert the probe into the gingival margin where the sulcus lies until there's tissue resistance and you feel the epithelial junction. The junction epithelium. So we will make pretend that this is where the junctional epithelium is. So what you first want to do is, as you see, you want to establish a fulcrum. And you want to walk the probe from one tooth to the next to make sure that you're able to read the pockets, to read the increments of the measurements. So when you rest your finger when you rest a fulcrum, you're able to control and stabilize the hand position, and it's a less cause of injury. If you have something to hold on to, you're more likely that you'll have more dexterity to go around to the next tooth. So you want to avoid pushing. You want to avoid pushing too hard into the tooth, into the sulcus, because that could lead to false numbers. You always want to keep the tip of the probe as parallel as possible to the long end of the tooth. That is definitely a question on the boards, I remember. So you might find that the probe is obstructed by calculus, plaque, bleeding. You have to make sure that you can go in between slowly, and some offices will allow you to have an assistant that they can actually record the numbers for you. And if not, if you don't have that, then you must do it on your own and either write it down or onto the computer, and you'll have to just continue going back and forth with your barriers, of course. Anyway, so you wanna avoid pushing down too hard, because the tip of the probe can puncture the attachment and cause patient pain, inaccurate measurement, and of course trauma to the patient. You might find that the probe is obstructed by the ledge of calculus. We went over that already. But if the probe does not move, use a gentle measure. Yes, so if the probe doesn't move, it's probably because there's something lodged in there. Maybe like calculus, or, you're not able to go in there, and it's most likely calculus. So once you feel like a soft rubber band, kind of like if you go in here underneath my fingernail, you'll feel like a soft band that goes up. That's when you know that you've reached the junctional epithelium. So the measurements, how do you record the measurements? The measurements are recorded at 6 places of the tooth. So you will record on one side of the tooth, in the middle, and then on the other side of the tooth. So let's say this is where the molars are, so it'll be distal, you're going right in the midline, and then mesial. I just made like little attachments here. And then you'll walk the probe like this, like so, to get your accurate measurements. So that's 1, 2, 3, and then if you go around the entire tooth, you have to come around the entire mouth to get back to this tooth, and that's again 3 measurements of one tooth. And you want to do this walking with the probe along the gum line. You want to keep the probe inside the pocket. You don't want to move. If I had a type of dent, it would be a lot easier to show. You want to walk it around the mesial buccal area, because this allows you to follow the shape of the tooth. Yes, that's what I wanted to say. It allows you to follow the shape of the tooth without leaving the sulcus. And that is the explanation of my probe, one of my favorite instruments.